Hi, my name is Kate Brown. I'm a UAM nursing student, and today I'm going to be teaching you how to do a subcutaneous injection. So for today, our dose is a 5 unit of regular insulin, 1 dose. And so the first thing that we're going to do is we're going to check their blood sugar and make sure if it is high, that's when we give insulin. If it's low, we wouldn't be giving any insulin. And then we're going to check the MAR and make sure that the 5 rights of the medication are right. So that would be the right patient, the right time, the right drug, the right dose, and the right route. Okay, so once that's all good, that's when we'll go into the med room, and that's when we'll get this one-time use vial of insulin. And so then we're going to be using a needle, and so this needle is a 1 milliliter needle, 28 gauge, and a 3/8 needle. So then at this point, I'm going to perform hand hygiene, and I'm going to put on my gloves. So now that I've put on my gloves, I'm going to get this alcohol pad and I'm going to wipe off the top of the vial. Okay. Now discard of that in the biohazard bag. At this point, I'm going to get my needle out. I'm going to uncap the needle, okay, and so then I'm going to draw out 5 units of air. Okay, there's 5 units of air. So then I'm going to inject it into the vial, and I'm going to push out that air. I'm going to turn it upside down at eye level and withdraw 5 units. Okay. Alright. So then I'm going to make sure there's no bubbles, getting out any bubbles. Okay. Okay. So now I'm going to cap the needle. And now I'm going to dispose of this insulin because it's a one-time use insulin. Okay. And so then at this point I'm going to check the MAR one more time, and I'm just going to make sure that all the 5 rights are there. It's the right patient, right dose, right drug, right route, and right time. So now I'm going to take off these gloves. I'm going to dispose of that in a biohazard bag, perform hand hygiene, and then put on new gloves. So now that I have all the new gloves on, I'm going to assess the skin, make sure there's no bruises, no swelling, no kind of ecchymosis, inflammation, none of that. Okay, so now I'm going to use this alcohol pad, and I'm going to wipe the skin. I'm going to use a circular motion from the inside to the outside. Okay. And dispose of that. Okay, so at this point I'm going to check the needle and make sure that there's 5 units in here, and that's right. So then I'm going to uncap it, and this is an average patient, so because of that we're going to pinch the skin at a 90-degree angle. If they were obese, we would taut the skin. Okay, so now that's uncapped, we're going to insert at 90 degrees. Wait a second, pull it out. I'm going to cap my needle using the scoop method. Okay. And now I'll use a cotton ball. If there's any bleeding, just rub around. I could, if there was more bleeding than usual, I could bandage a cotton ball over. I'm going to assess the skin for any kind of abnormalities and make sure the patient's okay, and that's it.